So I want to just clarify something really important. The difference between a private patient advocate and, say, the hospital advocate, the medical center advocate, a agency advocate, is that a private patient advocate is somebody who is exclusively working on your behalf. A patient advocate in a hospital that is employed by the hospital usually is working under the Department of Patient Relations, which has to do more with patient satisfaction and liability control. So they don't really have any power. They're almost never nurses or anybody medically trained. They're just somebody who is going to listen to you, and nothing's really going to happen. I have very rarely ever heard of any positive outcomes within the patient advocacy world of the hospital systems and healthcare systems, whether it's an HMO or whatever it may be. But mostly they're in larger hospitals. There may be a patient advocate, but literally none of my clients have ever had any positive experiences. I've never known anybody who's ever actually had any outcome that or anything substantial that they were speaking of was addressed. So I want to be clear. The only person who is working on your behalf is somebody you hire to be your patient advocate, or somebody who is trained and able and competent to be your patient advocate, right? So you might have your family member, your DPOA, right? We all need to have all that stuff done. Who's going to be making decisions? But then making informed guidance is different, right? So you need to have somebody who is, I would say you need to have somebody who's medically trained, a nurse. There are lay people who do patient advocacy, but I'm going to tell you there are a lot of shortcomings there as well. And I know some of these people might come for me. There are different situations and different levels of advocacy, but if you are in a hospital situation and you don't feel that you are getting the care you need, going to a dog groomer who's a patient advocate is not going to help you, okay? Let me just be really frank. You need somebody who is medically trained. You need an RN, a respiratory therapist, an MD, right? You need somebody, and even an LPN, right? Somebody who is familiar with at least the basic medical terminology and understands pathophysiology and what's going on, because then they can be asking some tough questions of the providers that somebody else may not do. They may say, well, what's going on? We need more help. We need more of this. Nothing's being done. But they lack that specificity. And that's the difference when you have an RN who is a patient advocate, a respiratory therapist, again, somebody who is trained medically, an EMT. You've got to have somebody who understands the medical world and can speak laterally to your providers and